Want to avoid medication errors like a pro? Don't rely on memory, use a system. Because in nursing, distractions happen. Call lights go off, phones ring, patients ask questions, and your brain is already juggling 12 things at once. Welcome back to the Nurse Scrub Club. I'm your nurse educator, RN Stacy. Today, we're breaking down the medication safety habits that prevent most med mistakes before they reach the patient. Medication safety is not about being perfect. It's about building checkpoints that catch mistakes early. The safest nurses are not the ones who never get distracted. They're the ones who know distractions are coming and use a system anyway. Medication safety is about building checkpoints that catch mistakes early. The safest nurses are the ones who know distractions are coming and use a system anyway. Here's the simple flow. Pause, verify, scan, match, double-check, and reassess. Think of it like a cockpit checklist. You don't skip steps just because you've done it 100 times. Habit 1. Pause for 5 seconds and run the 5 rights. Right patient, right medication, right dose, right route, and right time. That 5-second pause may feel small, but it gives your brain a chance to catch what autopilot might miss. The pause breaks the rush. It forces one question. Am I giving the right thing to the right person? In the right way? At the right time? That question is simple, but powerful. Habit 2. Scan the wristband and use 2 identifiers every single time. Ask the patient to state their name and date of birth when possible, then compare it to the wristband and the MAR. Similar names can fool anyone. The scanner is not a decoration, it is part of the safety net. And don't be afraid to involve the patient. If the patient asks, "What is this medication for?" That is not an interruption. That is a safety checkpoint. Use teachback when you can. Habit 3. Read the label and match it to the MAR, word for word. Do not trust the cap color, vial shape, package size, or what you think you grabbed. Look-alike and sound-alike medications are sneaky. Read the actual label. Medication packaging can trick your eyes, especially when you're tired or moving fast. That's why the habit is not "I recognize this." The habit is, "I verified this." Big difference. Habit 4. Treat high-alert medications like a cockpit checklist. Insulin, heparin, opioids, concentrated electrolytes, and certain IV drips can cause serious harm if given incorrectly. This is where independent double checks, pump guardrails, correct concentrations, and clear labeling matter. For IV medications, trace the line from the bag to the pump to the patient. Verify the medication, concentration, rate, route, and pump channel. One wrong channel can turn a routine med pass into a real problem. Habit 5. Stop before you push. Ask, does this medication make sense for this patient right now? Check allergies, vital signs, key labs, and interactions. A blood pressure medication may be ordered, but if the blood pressure is low, you need to pause. A medication may be scheduled, but if the potassium, creatinine, glucose, or respiratory status is unsafe, you need to think before you give. Sometimes the safest action is not giving the medication yet. Hold when appropriate, follow your facility policy. Notify the provider, document clearly, and retime the medication if needed. Safety is not just giving meds on time, it's giving meds safely. Watch for common traps, interruptions during med pass, similar patient names, look-alike medications, unsafe vitals, abnormal labs, unclear orders, wrong pump channels, and medications that should not be crushed. Let's recap the med safety system. Pause for the 5 rights. Scan the wristband and use 2 identifiers. Match the label to the MAR word for word. Double-check high-alert medications. And stop before you push by checking allergies, vitals, labs, and whether the medication makes sense right now. Remember, medication safety is not about trusting your memory. It's about trusting your process. Pause, scan, match, double-check, and reassess. That's how you protect your patient and your license. Join us at the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable. Like, share, and subscribe for more nursing skills made simple.